Hello, this is Dr. Dawn Michael, and let me just adjust my screen and stuff here. I'll be with you in a second. Adjust all this stuff. There we go. Hopefully you can see me a little bit better here. Don't want to fiddle with it too much. Okay, how is that? All right, so I was on with you this past Tuesday, and I was having a great discussion, and I had a bunch of you asking questions and so on and so forth, and my power went off on my computer. And so I had to end abruptly, and I really wanted to come back on before Tuesday. I'm going to be back on Tuesday once again and do a live session for all of you. But in the meantime, I thought it would be great to hop back on today. So give me a moment and let's see if we can get a few more people in before I get started. It's going to be fun. I have something I want to talk about today. I had a couple of people from our last live session ask questions about performance anxiety, about being not sure about having an orgasm when they wanted to have an orgasm. And I wanted to bring up this really great question that somebody asked about performance anxiety. I didn't put out any information that I was going to do live today, so I don't have those feelers out today for people to pop on. It'll just have to go to my subscribers, and we'll see what happens. Okay, so give me a second here. It's Friday, so that's exciting. I'm looking forward to the weekend. I hope that you are as well. All right, so let me get started on what I have here for performance anxiety, and then I will start to take your questions. Okay, so what happens is when someone has performance anxiety when it comes to the bedroom, it can be really frustrating. And over time, it can make it so that a person is not even interested in having a relationship, or the anxiety is so bad that it stops them from getting into relationships. This can also happen at any point in a man's life as well as a woman's life. Performance anxiety is not just a male problem, it is also a female problem, but the difference is men's sexual organs are front and center, whereas a woman's is not. So she can hide her performance anxiety better than a man, and it doesn't become so out in the open if she's having problems. Now, because men and women both have erectile tissue in their sexual organs, that tissue needs to be filled with blood in order for it to have optimal performance. So yes, women have erectile tissue as well as men do, but again, for a woman, you can't see it because a lot of it's located on the inside. But for her, if her organs do not fill with blood, it can cause pain. It may impede from her having an orgasm, and it could just be uncomfortable. For men, they're not able to perform intercourse because they are not able to maintain an erection, and that could be very frustrating. The other part of it is their partner can see it, and many times their partner will say something, and it can be embarrassing or frustrating. And so I'm going to go over the difference right now if it's a health-related problem or if it's a psychological problem. And I will say, in most instances, it is a psychological problem, but sometimes it's hard to determine, especially if somebody gets older or they've had some health issues. Now, some health issues that can impede blood flow would be diabetes, and that's a big one, and prostate cancer, if men. Just to give you on the difference if it's medical or not. So if it is a medical issue, it means that when a man wakes up in the morning or through the night, he will not have an erection. So men typically have 3 erections during the night and into the morning. That's just your body taking care of itself. It has nothing to do with being excited. Sometimes men will wake up in the morning and will have an erection. It doesn't mean that they're sexually aroused. It just means that their body is functioning normal. Now, if you don't have that, then you're still not able to maintain an erection and performance anxiety, if that's the case, you really do need to go see a cardiologist to make sure that your heart is okay, because that is probably one of the biggest indicators that someone has an issue with blood getting to their heart, is that it's not able to get to their sexual organs. So now that we have that part figured out, the health aspect of it, let's talk about the psychological part. Okay. So I'm going to go over a list and just talk about performance anxiety. And I see that we have someone on. Tassos, hello. I'm glad that you're on this morning. And hopefully we'll get a few more people to jump on and we can answer some questions. But I'm going to continue to talk about this as this continues to get out with people. Okay. So performance anxiety. So you're anxious about performing sexually. Your sexual organs do not work. And what happens is when you feel anxious, and I went over this last time, the body automatically goes into fight or flight, meaning that the blood that's necessary to fill your organs, it leaves and it goes into your legs. So that would be a response. You're having anxiety, you're having fear. So the blood rushes to other parts of your body in order for you to run, okay? That's an instinctual thing. That has nothing to do with you having control over it per se. I'm going to explain how you can have a little bit more control over it. But the reality is if you go into fight or flight, you can bet that you're going to lose an erection. And women too, if that happens to them, they're also going to lose the blood flow that helps to cushion intercourse and so on and so forth. Many women don't realize this, and that is one of the things that can lead to painful sex. I know most of my audience are men, but men have wives and girlfriends, and it would be great if you have them watch as well, or you can relay that to them, because that is the number one issue of why women have pain, is that they're not getting fully aroused and the blood is not engorging their sexual organs. And that can be a real problem for women. Okay, but back to this idea of anxiety and fight or flight. So if you have this anxiety and you go to have sex and then you notice, uh-oh, my penis is not working, okay, the first thing is you're going to have more anxiety about it. And so that creates this hamster wheel of it's not going to happen. And then all of a sudden you're thinking it's not going to happen. And it doesn't happen. And it could be that this happens once in a while. This does happen for men a lot when they get into a new sexual situation. And it doesn't matter per se what age you are. It happens more often when you're older, but it can happen to younger people too. If it happens to somebody that's younger and it's persistent, they may actually start to have fear when it comes to sex when they're younger. And this can persist to when they get older, which would really impede on them getting involved in relationships and wanting to have a girlfriend, wanting to get married. And I do see this happen in a percentage of men. And in fact, I've been seeing it more. I'm not sure why it's happening. It could be related to porn, for instance, where, you know, a lot of the men are well endowed, and I know that some men have expressed that gives them anxiety because they look at themselves and they don't feel that they are adequate, and that can even relate to having self-identity issues, self-confident issues. And I'll just say this to the men out in the audience, it's totally unrealistic, and those are just actors. So I would never base the way that you look as opposed to something that you're seeing on screen. Okay, so let's get back to what you do in a situation like this. Now, this depends on if you're in a new situation or if it actually has started with a partner or a spouse. So these are two different situations. So let's say that you get anxiety in a new situation. Sometimes medication can help with that, meaning like Viagra or Cialis. It can help you just to get over that anxiety in a new situation, but it is a Band-Aid. I will say that. It doesn't work all the time. The commercials are completely wrong when it comes to that. If you are not able to get an erection, you will not be able to maintain an erection. So the medication only helps if you're able to push the blood into the penis. If the blood is not already there, the Viagra will not help. But in most cases, men can get the erection and then they just have a problem keeping it because the anxiety kind of, takes hold and they're not able to maintain the erection. And that's where like the Viagra or Cialis can help with something like that. But again, it's temporary. And if you continue to use it long term, then really you're not dealing with your sexual anxiety. You're just taking medication. It becomes a Band-Aid and it'll happen over and over again because you have not resolved it. All right. So I'm going to get back to that in a moment. Just waiting for a few more of you to show up. I think next time, I'm definitely going to keep it on Tuesdays because I had a lot of you come on and ask some great questions. And I think that maybe sending a link out to Twitter, or if anyone has any ideas, or if you want to send any links out, that would be great too. Okay. So let's get back to the idea of what to do for this performance anxiety. And believe it or not, it's pretty common. Most men have it at some point in their lives. And it could be even in a long-term relationship. Sometimes it can deal with stress going on at work or at home. It can deal with, new situation. Obviously, with COVID and the situation going around that, at first I thought, oh, people are going to be in their homes and, they're going to have time to build the intimacy and be intimate with one another. But it really has not turned out that way. Most people have ended up being quite depressed over it. And that has not helped people's sex lives at all. In fact, it has hurt many people's sex lives. So COVID is not great for a person's sex life. Okay, so let me get back to this situation with performance anxiety. And all right, so if you think about it in the way that it might happen throughout your lifetime, then when you're in a relationship with your spouse or a girlfriend, and it happens to you, many times your spouse might say something, and that again will trigger more anxiety. And women don't understand that men can lose an erection, and it doesn't mean that they're not aroused. They can still very much be aroused, but again, the blood is not flowing, and so they end up losing it. And then many women are not educated in that or understand that to know that it does happen for men, and it doesn't mean they're not attracted to them or not aroused. And I've worked with many couples where this situation happens. Well, they'll come in and she'll say, well, I don't think he's attracted to me anymore, or, something along those lines. And I'll ask him, and I'll say, no, I'm very much attracted to her, but I'm having some anxiety. And by her saying that makes me more anxious. And so then each time they get into that situation, he becomes more anxious. So it's really helpful if you have a partner that you can explain this to. You can even show them this video if this is part of, the problem that you're going through, and say, I don't really have much control over this. I have anxiety and it comes and goes. So something that you can do if you get in this situation, obviously, is to focus on the other person. So take the focus off yourself. Try to get out of your head with this and stop thinking about it and focus on the other person. Focus on a different situation. You can even focus on a fantasy that you have. Anything to get your mind off of, your anxiety. Now, another thing that you can do, believe it or not, is before you get in the situation is you could do breathing exercises. Some people, this really works. And so you try to do some deep breathing, you try to relax your body, and then get yourself in a different place. Because again, what happens is you want to get out of feeling anxious. Because again, if you feel anxious, the blood leaves your organs and it goes again to your feet. So you want to do anything to quiet down that feeling, to calm yourself down. And deep breathing really helps. And so if you haven't done any deep breathing, there's tons of videos out there that can show you how to do deep breathing. I even have a few that I'm trying to remember which videos I have that in. If I find it, I'll attach it to this video so that you can kind of do some of the deep breathing exercises. They really do help. And if you utilize it, it can help you with other aspects of your life. If you get yourself in a situation where you're feeling anxious, you can try the deep breathing exercises and it will really calm your central nervous system down. And that's the key, is to just calm yourself down and get yourself in a better headspace where you don't feel anxious. So we have focusing on your partner, so not focusing on yourself. And then we have some deep breathing. Another thing that you can do is self-stimulation. If you see that you're not getting any blood flow, then do some self-stimulation. If your partner, your spouse, finds that that is odd, you can tell them why you're doing it. And again, say it has nothing to do with you. I'm just taking care of what I need to do to get back into the situation. And that does work for some people. You can have also, if you have a very willing partner, they can help you with stimulation, and the two of you can get back into the sexual situation. There's nothing more frustrating for someone that has really bad performance anxiety, who really wants to be in a relationship or wants to have a good, strong, intimate relationship with their spouse, for them to have this problem. It's frustrating, it's maddening, and it's very important that if you're in that situation, you talk to your spouse about it and let them know. There is a really great book. I'll have to attach it to this video. I'll attach it to this video. It's a fantastic book for men to read, just about any type of performance anxiety, lack of confidence, how their body functions. Most people don't know how their body functions sexually. We are not taught proper sex education. We're not taught that in the school system, which personally I think that our parents should be teaching us this. But parents don't know. So it's really good to understand how your body functions sexually. It'll make any situation better because you'll be able to understand that it's just, normal for these things to happen. Okay. Oh, one more thing that I brought up in the last video was medication. Any type of medication can have side effects where either you're not able to have an orgasm or you're not able to get an erection. So medication can have that side effect, especially antidepressants. So if you're on an antidepressant and this is happening to you, I would definitely consult your doctor and find out which medications do not have side effects, because they have come out with other medications, especially antidepressant medications, that do not have sexual side effects. So you might want to look into that. Okay. Oh, another thing too is exercise. Exercise is also important because what does exercise do? It gets your blood flowing. And when you're talking about not being able to maintain an erection, it's all about blood flow. And so if you are exercising, if you're involved in, some type of sport, something that you enjoy, that is a great thing to really get your whole body healthy. Also, what you consume can play havoc on the blood flow. So you want to make sure that you're not eating a lot of high calorie foods and really putting excess weight on. A lot of belly weight, really heavy belly weight, can be a problem with blood flow and maintaining a good erection. So all of those things are very important. And I am going to wait a couple more minutes to see if we have a few more people come on and I can answer some questions. I would love to get some of your questions today. I will sit here for a few more minutes and wait with you guys and have my coffee. How many of you drink coffee in the morning? Just curious. Thank you for saying that, Michael Shaw. I do hope that what I'm doing out here, you said, thank you, doctor, for all this information, much appreciated. One of the reasons that I do this and I come on to say the things that I do is I really think we're lacking information. There is so much misinformation out there and people get so confused. I just think it's gotten even political, like things about sexuality and sex, they've become political where it really should be based on factual data, experience, and this would help people so much more with the confusion out there. Let's see. But it has to have creamer. Okay. Tasso, I do first thing in the morning. I have coffee in the morning. Okay, so we have a bunch of coffee drinkers here. Yay. I have 1 cup of coffee. That's it. But that seems to get me going for the day. I do have to have it. So I won't say it's my one weakness because I really don't think there's anything wrong with having 1 cup of coffee. But if I don't have it, I do feel it later on. So how are you all doing out there with COVID? Should I even mention that or bring that up? What state are you guys in? I don't even know which state, or I had some people on my last live that were from different countries, which is really cool. And I will tell you one thing about me that most people don't know, is I have worked with people all over the world. I was on a system called Live Person for a while, and before they changed out, I had spoken to thousands of people for several years from all over the world that had all types of issues. It was fascinating. And I do know that there's still some people who are on my YouTube that I probably have spoken to throughout the years. But it really gave me an insight into how people think about sex. And there are definitely cultural differences. And I want to say this, that the real thing that we often don't remind ourselves of is biology. Sex is based in biology, and we can't forget that. I know that there's the powers that be out there want to negate biology, but there is a distinct difference between men and women and how they function sexually and how their brain works sexually. There is a distinct difference. And it's not bad. It's complementary. And we've gotten away from that everybody has to be the same and everyone has to be treated the same. Well, no, we have our strengths and our weaknesses, and it's something to be celebrated. It's not something to divide us. And it works, God created men and women to, come together and it's kind of, a union where we complement one another. And we really need to get back to that complementary union. Let's see, what else do we have here? So you watched, so Fudge says, I remember watching one of your videos that talked about Kegel exercises, and I haven't stopped since. Kegel exercises are great. Sometimes men think that they're just for women, and they're not. It's how you strengthen your erection is doing Kegel exercises. And one of them is when you have an erection is to take like a small towel or something, or you don't even have to do anything, put it towards the back of the penis and do exercises. It strengthens the muscle. That's one of the biggest muscles in our body, is the muscle that holds up our bladder, for men, that, you know, the prostate, everything. And when that particular muscle, because it's like webbed together, so if you think about this, you have this tight muscle, and when it gets loose over the years, then everything kind of falls. For women, they have much more problem with that. And so it really, for women to do Kegel exercises are very important. But for men, Kegel exercises are important as well. So you want to strengthen that muscle. And you can do that where it feels like you're either holding in your urine, or, I mean, you can see it mostly when you have an erection and you're moving your penis up and down. So that will strengthen that PC muscle. So what else, you guys? Any other questions? We have a few more people on. Any more comments on anything? I didn't see, if you can just post, what state are you from? Are you, and if you're out of, I'm from California and in the United States. So do we have anyone that lives out of the United States on here? Which state are you from? Oh, wait. Greece. Wow. Very nice. Hey, how are things going on in Greece? What is it like over there with the lockdown and everything? Any comments on that? I know each state here, it's different. Oh, from England. Oh, so Michael, you're from England. Well, we have this is great. This is an international show now. So you're locked down in Greece. Is everyone still having to wear masks over there, or what's the situation over there? I know what's going on in England. I know it's pretty bad. I watch a few shows on people from England and that are from England, and things over there are not great. Although, you know, I'm from California, so we're basically in permanent lockdown over here. Not fun. Although people are sick of it and they're fighting back. So I'm happy about that. Oh yeah, so in Greece, you're having to wear masks and things aren't great. Yeah, it's been crazy. It's been really crazy. Where else? So we have Greece, we have England. What other places do we have people from here? You can speak up. I know how many people are watching the video live. No? Okay, well, I'm going to give it a couple more minutes to see if some more people pop on before I leave. I'll have let's see, Fudge, I'm sick of it, but I still do my part by keeping my distance and wearing my mask. Okay. Everybody has different ideas on that. I had another site up on YouTube, but it got, you know, I started doing some videos. I think I did about 6 of them, but they took down 2. So I just decided that I was going to just stop doing it. You know, I guess I must have said some controversial stuff. All righty. So anyone have any plans for this weekend? Anything exciting, or is everyone just so completely locked down? Oh, I see. Fudge, you're from Los Angeles. Okay, so you know what's going out here in California. Let's see. Leave a link for the breathing exercises. You know, I have to go through my videos to see which one it's in, and I will try to leave a link for that. I don't know if the title is breathing exercises, but I will go through my videos and I'll leave the link under this one. And also, if you have any questions that you do want to ask, You can also put the comments under this video here, and I will use them for the next show. And I'm just going to sit here for a minute and wait before I go off. I'll give it maybe another 5 or 6 minutes to see if you guys want to ask any questions. This is for you. You get to ask the most amazing questions that I'll try to answer, and you can put me on the spot too. Oh, my background when I was getting my undergraduate was speech communications. So I did speech and debate for about 3 years. I traveled around the United States doing speech and debate. That was my undergrad. And then my master's degree, I got it in marriage, family, child therapy. And that was an interesting experience. One funny thing that happened is during, while getting my master's degree, they would have us sit in a room, and they would actually show us videos, pornography videos. At the time, I was probably in my mid to late 20s, I think. And I remember sitting next to a lady, she must have been at the time, maybe in her 60s. Anyway, I don't think she had ever seen porn. Now, we're talking a long time ago. I'm giving my age away, but we're talking a long time ago. And I remember her sitting next to me, and they started playing the porn. Now, just imagine, we're all sitting in this room. We're all getting our master's degrees. We're, educated. And so this is part of our education, is we have to somewhat be desensitized. We have to know what people are watching out there and what are doing. And so we have to view this stuff ourselves. And I will never forget, she was sitting next to me, and they put this video on. I don't remember what it was. I think it was just, back then, I think it was just a man and woman having sex. She nearly fell off her chair. She got up and she left the room. So yeah, I guess people are more up to date with, or therapists are more up to date concerning sexual issues, but they still only get 2 classes on human sexuality. And back then, that was the idea, where a lot of people just didn't know what was going on. Things have gotten a little better for therapists, but they still haven't. I just don't think a lot of them are up to date and really know what's going on out there as far as when it comes to sexual issues. So I ended up then taking a year-long course to get my certification in human sexuality, or as a sex counselor, certified sexuality counselor. So I took a year-long course. Wow, that was intense, I will tell you, because it wasn't only that we were learning information, but what we were exposed to, it was intense. We had people coming in and talking to us about their different lifestyles. We went to different places to view different things and really put ourselves out there as educators and counselors to see, how different people lived and what sexual experiences people had. So that was very good training. And then I went on to get my PhD in human sexuality. I got it at a small school that was in San Francisco. They're no longer there. Insane experience. This school, they had access to the biggest library of sexuality in all of the world. So I was able to see theses from people from all over the world. It was all based on sexuality, and really had some great training there. So it was very exciting. So that's basically my background. I've also worked at a psychiatric hospital. I did couples interior design for a while. So I've basically been helping people for probably on and off for probably 30 years. And I really enjoy it. I've written 2 books. I've written thousands of articles. I was the LA Love and Marriage Examiner for about 8 years. I've been featured as an expert with my opinion in Cosmopolitan, Brides, Men's Health, Prevention, Reader's Digest. Let me see what else. I don't know, almost all the magazines out there. So I've had a lot of exposure, and I've been out in the media, and it's been interesting up until the past 4 years. Yeah, 4 years, which I won't get into that now, but let's just say that all of a sudden I am no longer asked to be in magazines because of, I guess, because of my political opinion on things. I've basically been kicked out of a lot of the mainstream media stuff that I used to be a part of. And it's pretty sad that it's come down to that, because I really want to help people, and I have a lot of valuable information that I'd like to share with everyone. So let's see what this question is here. Hi, Dr. Dawn. What are the greatest relationship challenges that you see with people or help patients with regarding the current pandemic? That's a good question. Well, it's been difficult because I think a lot of people are actually dealing with mild cases of depression. People are down. They're feeling somewhat hopeless, and they're not wanting to be so affectionate with each other or intimate with one another. When you don't feel good or you feel unsure of things, it does affect people's sex lives. And I think this has taken a toll on people's sex lives. Also, not being able to get out and move freely, not knowing what the future holds. A lot of this has been very stressful. Another problem that I've seen is people are drinking a lot more alcohol and even getting involved in drugs. And when this happens, it affects sexual performance. So if you're maybe someone that has a couple drinks a night, if you're having several more drinks, then your body's not able to perform sexually because of alcohol or drugs. And I've definitely seen an uptick in that due to the lockdown. That was a good question. Let's see. Can I ask about humiliation? I sometimes feel I can get more turned on by being humiliated by my wife than actually making love to her. Why do I feel this way? This is from Michael Shaw. Okay, so humiliation, there's an aspect of that increases your adrenaline, which increases your dopamine levels. So there's a certain rush you get. So if you were humiliated at one time, your wires can get crossed, believe it or not, with some people sexually. It's confusing, but it happens. And so what happens is you get this rush, and it feels good, and it spikes your adrenaline and dopamine, and it kicks in arousal. Now, this can be something that is a learned response. I would definitely see if you're functioning physically as far as, I don't know if you have any anxiety or depression. Sometimes that plays into it, and you need that rush to get aroused. That happens with some people I've worked with the humiliation. Another aspect of humiliation is that someone's paying attention to you, believe it or not. That's why this can be psychologically so confusing. But when someone is actively humiliating you, is that they're taking over, they're paying attention to you, and you don't have to really do anything. So that's another part of it. I'm not sure if I answered that question for you or not. You can let me know. Okay, let's see. Yes, Fudge said, I've personally seen the increase of domestic violence since the pandemic started. So hearing the doctor's pro advice would help with spreading some great information of those in need. Yes, Absolutely. There has absolutely been an uptake in domestic violence. And you can see why, because people are stressed out with their finances. Some people are not working, children are home from school, and drugs and alcohol play a big part in that as well. If you're drinking more, you're stressed, you're with your partner, your spouse all day long, then it's just a recipe for fighting, and that can lead to domestic violence and child abuse. It's really gone up. It's very sad. It is very sad. Okay, let's see. What else do we have here? Amor, are used to have issues with this when I had a girlfriend who was super intense about sex, felt like she was putting pressure on, didn't want to let her down. I think you're talking about with performance anxiety. Yeah, absolutely, that can happen. Any type of pressure to have sex can create performance anxiety in men and women. But believe it or not, men get pressured too. So it's not just a one-sided thing. And if you're feeling pressured, then it's hard sometimes to get aroused, or it just becomes more like a job in a way for both men and women if there's pressure involved. So absolutely. Thank you, Michael, for the super chat. I appreciate it. So anyone else have any burning questions that they want to ask? I see we have a few more people on, and I've taken the time out today to try to stay on for close to an hour, because really the last time I had so many good questions, and I was so bummed that the computer just went off. And you can ask questions about anything. It doesn't have to be sex related. It can be with your relationship, because as stated in one of the questions here, people are really having strained relationships right now. And anything I can do to help or give you some advice. One of the things I will say is, if you feel like you're going to get in an argument or say something, one of the best things you can do is not let your ego get involved, and back away and take a deep breath and think about the situation before it gets out of hand. A lot of people will just react, and really it should be that the relationship is more important than a person's ego. And that is also a sense of maturity too, is to kind of put your ego aside and resolve the problem rather than be right. A lot of couples, believe it or not, they argue about, in the end, who's going to be right, and that doesn't resolve anything. Let's see, do we have anything else? Okay, so that did make sense, Michael, with the humiliation aspect. Good. I'm glad I was able to answer that for you. It's complicated. There's more layers to it. I've worked with many people who, believe it or not, do have, who get turned on by humiliation, and it's complicated. It's not just one thing or the other. But what I will say with that is, if you're with somebody and it doesn't create a problem in the relationship, then I just see that as, sexual play. Although if it starts to create a problem, that's when you have to deal with it. Let's see, what else do we have here? Is it normal to masturbate every day? I'm a man. You know what? I don't say normal or abnormal. It really has to do with your sexual pattern. If it's something that you've been used to most of your life, then you probably are going to do it every day. The only time it becomes a problem is if it gets in the way of you having intimacy or sex with your spouse or your partner. And if that becomes a problem, then the masturbation every day becomes a problem. And also, if you're married and you're out of sync with your partner sexually, then you may want to decrease masturbation to every other day, because it does increase your sex drive because your body knows that you're going to have an orgasm. And so your body gets used to that. And so if you want to decrease it, then you might want to do it every other day. If you're single and you're doing it and it's not a problem, then it's not a problem. It's only a problem if it becomes a problem, if that makes sense. So there's not really any normal. It's normal for you. So some men masturbate every day. Some men masturbate every other day. Some men masturbate every 3 days. Some men masturbate every week. It's just what your normal is for you. And if it's creating any problems, then that's when you have to deal with it. Let's see, what else do we have here? We'll wait for the next time to ask another question. Thank you for taking the time to help others be well. Thank you, and have a great day, Matt. What else do we have here? What's your take on some man transitioning from male underwear to women's? I personally wear, but it does not affect my love life or my marriage. Well, you basically answered your own question, because if it's something that is not harming you, you're an adult, or your relationship, then that's a personal choice to you. So I don't have a feeling on it one way or the other. I believe that, if you're an adult, you can, and you're not hurting yourself or someone else or hurting your relationship, basically you can do what you want to. And if you feel that you want to wear transitioning from women's underwear, then wear women's underwear, So I'm going to be on here for 4 more minutes. Any other questions from anyone else? You guys have been great today, and it's been fun. Been having a good time doing this. So I'll probably try to do some more live conversations here and there. Definitely, I will do them on Tuesday. So if you want to, tell your spouse to come on, maybe you and your spouse can ask questions, or if you want to send my link to other places to get more people involved, that would be great. I'm going to have another sip of my coffee and just wait a couple more minutes. I think it's very cool that we had some people on here that are from different countries. That's really neat that we're able to connect and talk like this. It's fantastic. Fudge, thank you for your Q&A session. Much appreciated. You're welcome. And I hope you guys all try to have a great weekend. And one of the things that I want to say to you is to be kind to yourself. I think oftentimes we forget to be kind to ourselves. And many times we're more apt to think negative thoughts of ourselves or put ourselves down. And when you do that, it just makes you feel pretty crappy. So, when you wake up in the morning, try to be grateful for the things you have and live in gratitude throughout the day, and be kind to yourself. Say nice things to yourself instead of negative things to yourself. You will notice that you'll feel much better. And also, you'll treat the people around you better. So when you're kinder to yourself, you become kinder to other people. So that's my word of advice for this weekend. All right, I'm about ready to wrap up for today. I will wait for 1 more minute, and then I will end this session. Okay. All right, you guys, it's been a pleasure, and I will be, let's see, attitude of gratitude works for me. Yes, I love the attitude of gratitude. Basically, I institute that in my life, and it has changed the way that I feel. Having gratitude is amazing. It really does put a new perspective on life and things, and it's great to live that way. All right, all of you, I will speak to you on Tuesday, so I hope to see you then. I am going to try to make this for 10 o'clock Pacific Standard Time on Tuesday and try to get my time down. All right, Michael, thank you, Doc. Love Q&A. I do too, having a good time. I will keep it up as long as all of you come on, and we can have some, I don't know, straight talk about things. Just talk about things. I think we need more of that, right? Okay. Have a great weekend. Talk to you soon. Bye bye.